Welcome back, everybody, for another deep dive. Today, we are going to be exploring stress and trauma,
Ooh.
how our minds and bodies react to these really intense experiences. And the text that we are going to be using to kind of guide us on this journey is the Handbook of Clinical Psychopharmacology for Therapists.
Oh,
And I think
boy.
you'll agree it's pretty fascinating stuff.
Yeah, definitely. It's amazing how much we can learn from studying, reactions to stress and trauma.
Right?
For example, did you know that a tragic event like the Coconut Grove nightclub fire
Oh, wow.
in 1942 actually played like a crucial role in our understanding of stress?
I actually didn't know that. So tell me a little bit more about that.
Well, after that horrific fire, a psychiatrist named Eric Lindemann,
Hmm.
he provided crisis counseling to survivors.
Oh, wow.
And he noticed some patterns in their responses. He
Yeah.
observed this kind of roller coaster of emotions swinging from these like intense outbursts of grief to periods of numbness.
Yeah, I can only imagine the range of emotions those survivors must have experienced.
Absolutely. And Lindemann's observations were incredibly valuable.
Right.
He saw how these survivors were, replaying the event in their minds, struggling with nightmares, and even experiencing like physical symptoms.
Wow.
His work was really groundbreaking because it highlighted the profound psychological impact of trauma.
So this really tragic event unintentionally became like a pivotal case study in how we cope
Exactly.
with extreme
And it
stress.
laid the groundwork for decades of research, including the work of Marty Horowitz, who wrote Stress Response Syndromes.
Mm-hmm.
He proposed a model to understand the different stages people go through after a traumatic event,
Okay.
outlining these typical responses that people have.
So let's unpack this model a little bit. What are some of those stages?
Well, the first stage is what Horowitz called outcry. This is the initial shock, the immediate aftermath of the event where emotions are raw and intense.
Mm-hmm.
It's like the mind and body's initial alarm system going off.
Yeah, that makes sense.
And then from there, people can either swing towards intrusion, where those vivid memories and emotions keep flooding back,
Okay.
or towards denial, where they try to shut down those feelings, as a way to protect themselves.
So almost like this pendulum swinging back and forth between, feeling everything really intensely
Yeah.
and then trying to completely numb yourself to cope.
That's a great way to put it. And as people start to process the trauma,
Right.
they move into what he called the working through stage, where they slowly grapple with the event and its impact on their lives.
Okay.
And eventually, ideally, they reach completion, where they've integrated the experience into their life narrative and found a way to move forward.
Wow, it's just so fascinating how even in the face of such chaos, there seems to be this underlying pattern,
Right.
this sort of roadmap for healing, even though it's rarely a straight line.
You're right. It's not always a clear-cut progression.
Yeah.
Sometimes things get more complicated.
Yeah.
And that's where we start talking about post-traumatic stress disorder, or PTSD.
PTSD, it seems like we hear that term a lot these days, but I think there's still a lot of misunderstanding about what it actually is.
Definitely.
Yeah.
PTSD is more than just feeling anxious after a scary event. It's a complex disorder
Right.
with a long history of evolving classifications.
Mm-hmm.
It was originally categorized as an anxiety disorder,
Okay.
but the DSM-5
Right.
now places it under trauma and stressor-related disorders.
So this shift in categorization suggests that PTSD is a much broader experience than anxiety alone.
Exactly. It encompasses a wider range of symptoms,
Right.
which are grouped into 6 main categories.
So let's talk about these symptom categories. What does PTSD actually look like?
Well, first you have re-experiencing the trauma.
Okay.
This can manifest as, intrusive thoughts, nightmares, flashbacks.
Right.
Anything that brings the person right back to that traumatic moment.
That sounds incredibly distressing.
Yeah.
Like reliving it over and over again.
It can be incredibly debilitating.
Yeah.
And then there's increased arousal,
Okay.
which is like the body's fight or flight response stuck on high alert.
Mm-hmm.
Think difficulty sleeping, being easily startled, feeling constantly on edge.
So their body's essentially in a perpetual state of ready to defend,
Exactly.
even when there's no actual danger present.
And then you have avoidance, where
Okay.
people try to steer clear of anything that reminds them of the trauma.
Right.
This can lead to, withdrawing from people and activities they used to enjoy, isolating themselves further.
Which makes sense as a coping mechanism, but also sounds like it could create a lot of loneliness and prevent them from actually processing what happened.
Absolutely. And then there are the negative thoughts and feelings
Yeah.
that often accompany PTSD. This might involve blaming oneself for the event,
Right.
feeling emotionally numb or detached, or struggling with, overwhelming guilt and shame.
So it really affects like their entire outlook on life and their sense of self and their relationship.
It can be very pervasive. And finally, there's dissociation, which is like feeling disconnected from yourself or your surroundings. It's
Wow.
almost an out-of-body experience
Right.
where you're watching things happen but don't feel fully present.
So with all these potential symptoms, I imagine PTSD is pretty common considering how many people experience traumatic events.
That's a common misconception. Actually, research suggests that less than 7% of people develop PTSD after a traumatic event.
That is surprising. I guess it speaks to the resilience of the human spirit.
It does show incredible
Yeah.
resilience, but it's also crucial to remember that those who do develop PTSD
Right.
might experience it in different ways. For example, there's acute PTSD,
Okay.
where symptoms last less than 3 months, and chronic PTSD,
Right.
where symptoms persist for a longer period.
So the duration of the symptoms plays a role in the diagnosis. Are there any other variations of PTSD?
Yes, there's also acute onset
Right.
where symptoms emerge immediately after the trauma,
Right.
and delayed onset where symptoms might not surface for months or even years later.
That delayed onset is particularly interesting to me. What could cause that gap between the event and the appearance of symptoms?
It's a complex question, but researchers like Lenore Terr
Okay.
have observed that the type of trauma plays a role.
Okay.
She differentiated between single blood traumas like a car accident and recurring traumas,
Right.
like ongoing abuse. Recurring trauma, she found, can have a much deeper and longer lasting impact, especially if the trauma occurred during childhood.
So the nature of the trauma and the age at which it occurs can significantly influence how PTSD will manifest.
Exactly. It underused the need to consider the individual's entire history when diagnosing and treating PTSD. It's not a one-size-fits-all disorder.
This is always so insightful. We've gone from the initial stress response
Right.
to the complexities of PTSD and its different forms.
And we've only just scratched the surface.
Oh,
Now let's dive into the biological impacts of trauma,
okay.
how these experiences can actually change the brain.
Ooh, that's what I call a cliffhanger.
Yep.
This is where it gets really fascinating. We'll be right back to explore that in more detail.
Welcome back, everyone. As promised, we're about to delve into those biological impacts of trauma, how these experiences can actually change the brain.
I'm ready for some serious brain science here.
Okay, so get ready to be amazed. There are these 6 major biological models that try to kind of explain these changes, each offering a different perspective on how trauma affects our neurobiology.
6. Okay, let's take them one by one. What's that first model?
Okay, so the first model focuses on attachment and this idea of repetition compulsion. This concept suggests that early childhood trauma, especially experiences of abuse or neglect, can actually create this powerful need for attachment even to those who have been harmful.
That seems a little bit counterintuitive. You would think trauma would make you want to avoid those who've hurt you, not seek them out.
Right, it seems illogical, but studies on animals, particularly primates,
Okay.
have shown that infants, even those raised in abusive environments, still instinctively seek out their caregivers,
Wow.
especially when they're stressed.
So even when faced with danger, the need for connection kind of overrides that instinct for self-preservation.
It seems that researchers believe this behavior is linked to the brain's separation stress center, which is, deeply rooted in our evolutionary need for connection and survival.
Right. It makes sense that infants are entirely dependent on their caregivers, so the drive for attachment must be incredibly strong, even if that caregiver is a source of fear or pain.
Exactly. And this might help explain why some people who experience abuse in childhood end up in similar patterns of harmful relationships later in life.
Right.
It's like this primal need for attachment overrides the logical part of the brain that says this isn't safe.
That's a really thought-provoking insight. It suggests that, these patterns can be deeply ingrained even on a biological level.
Absolutely. Now, the second model, attachment and impaired affect modulation, kind of builds upon this idea of early attachment.
Okay.
It proposes that if a child doesn't receive adequate care and nurturing in those early years, they may have difficulty regulating their emotions later on.
So it's not just about seeking attachment, but also about developing the skills to manage those intense emotions that inevitably arise throughout life.
Precisely. And again, studies with monkeys have shown that when infants are isolated or neglected, they often develop aggressive or self-destructive behaviors and struggle to soothe themselves when they're upset.
That's heartbreaking, but it really highlights how important those early experiences are in shaping our emotional development.
It really does. And this difficulty with emotional regulation is something we see in many people who experience PTSD.
Right.
They might struggle with chronic anxiety, irritability, or even engage in self-harm as a way to cope with these overwhelming emotions.
Wow. It's starting to really connect the dots between, early experiences, brain development, and then the long-term impact of trauma.
Exactly. Okay, so are you ready for model number 3?
Give it to me, I'm ready.
Okay, this one is hyperarousal.
Okay.
Think of it as the nervous system's inability to dial down the alarm system even when there's no imminent threat.
So the fight or flight response is stuck in the on position even when there's nothing to fight or flee from.
Exactly, and this chronic state of hypervigilance is thought to be linked to changes in norepinephrine receptors in the brain.
Now, norepinephrine, that's a neurotransmitter, right? I remember learning that it plays a role in the stress response.
You got it. It's like the brain's adrenaline, and it helps regulate alertness and arousal. Interestingly, some antidepressants that affect norepinephrine seem to be helpful in reducing hyperarousal in people with PTSD.
So by modulating these neurochemicals, we can potentially help the brain find a better balance and calm down that overactive alarm system.
Exactly. Now, the fourth model focuses on those intrusive symptoms that we talked about earlier, the flashbacks, nightmares, and intrusive thoughts.
Right, those could be absolutely terrifying, what's happening in the brain when those occur.
Well, researchers believe these intrusive experiences are linked to activity in specific brain regions, the locus coeruleus, the hippocampus, and the amygdala.
Okay, I'm not familiar with all of those. Can you give me a quick breakdown of each of those areas?
Of course, the locus coeruleus is like the brain's central alarm system.
Okay,
It's responsible for triggering our fight or flight response.
got it.
The hippocampus is involved in memory processing
Okay,
and kind of contextualizing our experiences.
okay,
And then you've got the amygdala, which plays a key role in processing emotions,
okay.
particularly fear and anxiety.
So trauma can essentially hijack these brain circuits, leading to those unwanted and distressing intrusive experiences.
That's a good way to visualize it. Now, the fifth model delves into the impact of those acute toxic levels of glutamate and cortisol
Right,
that surge after a traumatic event.
right. Glutamate, that's another neurotransmitter, and cortisol is the stress hormone.
You're right. In those immediate moments after a traumatic event, both glutamate and cortisol levels can spike dramatically.
Uh-huh.
And if those levels get too high for too long, they can actually damage brain areas responsible for emotional regulation,
Wow.
like the prefrontal cortex.
So it's like the stress response itself becomes a threat to the brain's ability to function properly.
In a way, yes. It's this biological overload
Right.
that can have lasting consequences.
Wow.
This is why researchers are exploring treatments that could potentially dampen this initial surge of glutamate and cortisol to protect the brain from, long-term damage.
It's incredible to think that we might be able to intervene at a cellular level to mitigate the impact of trauma.
It's a fascinating area of research.
Yeah.
And finally, we have the concept of kindling.
Okay.
This model suggests that repeated trauma can make the brain increasingly sensitive to stress over time.
Okay.
It's like each traumatic experience lowers the threshold for triggering that intense stress response.
So the brain becomes almost primed for trauma, making it more vulnerable to future stressors. It almost feels like an allergic reaction, where each exposure makes the reaction more severe.
That's a great analogy.
Yeah.
And while this model is still somewhat speculative, it offers a potential explanation for why some people seem to become more susceptible to PTSD after experiencing multiple traumas.
This whole discussion of the biological impacts of trauma has been truly mind-blowing.
Right.
It's amazing how much we're learning about this intricate interplay between our minds and our bodies.
It's truly remarkable, and it's important to remember that these biological models don't negate the psychological aspect of trauma.
Right.
It's a complex interplay of both nature and nurture, the biological and the psychological, all intertwined.
Right. It's not like an either-or situation. Trauma affects us on multiple levels, and understanding those different levels is crucial for providing, effective support and treatment.
Absolutely. Now, before we move on, I think it's worth touching upon a related disorder
Okay.
that often comes up in discussions of trauma, borderline personality disorder.
Okay, I've heard of borderline personality disorder, but I admit I don't know much about it. What's the connection to trauma?
Well, the relationship between borderline personality disorder and trauma is complex
Okay.
and still being studied. But clinicians often observe that many individuals with this disorder have experienced, significant trauma, especially in childhood.
So while trauma might be a contributing factor, it's not necessarily the sole cause of borderline personality disorder.
Exactly. There are likely multiple factors at play. To understand this disorder, it's helpful to look at it from different perspectives. The DSM-5, for example, takes a more behavioral symptomatic approach,
Okay.
focusing on observable patterns of behavior and emotional regulation.
So from that perspective, what are some of the hallmarks of borderline personality disorder? What might someone with this disorder struggle with?
People with borderline personality disorder often struggle with Intense and unstable relationships.
Okay.
They have a distorted sense of self
Hmm.
and experience extreme emotional swings.
Right.
They might engage in impulsive behaviors, have difficulty controlling their anger, and have a deep fear of abandonment.
Those sound like incredibly challenging experiences, both for the individual and for those around them.
They absolutely are. And alongside the DSM-5's perspective, there are also theoretical models like the concept of borderline personality organization,
Okay.
which delves into the underlying psychological dynamics thought to be at play.
What does that model emphasize?
It focuses on how early childhood experiences, particularly those related to attachment and the development of a stable sense of self, might contribute to the development of this disorder.
Okay.
It suggests that, early disruptions in those areas can lead to difficulties with emotional regulation, identity formation, and interpersonal relationships.
So it's a way of understanding the potential developmental roots of these patterns.
Exactly. And it's important to remember that there's a lot of variation within borderline personality disorder. Not everyone presents with the same set of symptoms
Right.
or the same severity.
That makes sense. Just like with PTSD, it's not a one-size-fits-all diagnosis.
Precisely. And this diversity is what makes treating this disorder so complex.
Yeah.
Each person's experience is unique, and therapy needs to be tailored to their individual needs and challenges.
We've covered so much ground today, from the intricacies of the stress response to the complexities of PTSD and borderline personality disorder.
Right.
It's clear that these are multifaceted issues with no easy answers.
Absolutely. But I think what's so fascinating is that even with all this complexity,
Right.
we're constantly learning more about the brain, the body, and the profound ways in which trauma can impact both.
And this knowledge is key to developing more effective treatments and supporting those who have experienced these incredibly challenging events.
Exactly. We've only just scratched the surface today, but
Yeah.
hopefully this deep dive has given you a glimpse into the fascinating world of trauma and the mind.
It certainly has. Now let's take a moment to gather our thoughts and then come back to wrap up with some final reflections and takeaways. Welcome back. I don't know about you, but after that deep dive into the biological impacts of trauma, I'm really starting to appreciate just how intricate the connection is between our minds and our bodies.
It's truly remarkable how adaptable the brain is, for better or for worse. And understanding these biological mechanisms is crucial for developing effective treatments and helping people heal from trauma.
Speaking of treatment, earlier we talked about psychotherapy being like the first line approach for PTSD.
Right.
Are there any specific types of therapy that are particularly effective?
Yeah, there's a type of therapy called exposure-based cognitive therapy that has shown really promising results in treating PTSD.
I've heard of that, but I'm not entirely sure how it works. Can you explain it a bit?
Yeah, so the basic idea is to gradually and safely help people confront those painful memories and emotions that they've been trying to avoid.
Okay.
It's done in a very controlled and supportive environment with the therapist, guiding the process every step of the way.
So instead of running from those difficult feelings and memories, exposure therapy helps people face them head on.
Exactly. It's not about erasing the trauma or pretending it didn't happen, but about learning to process it in a way that reduces its power and allows people to move forward.
That makes sense. It's like reclaiming a sense of control over those experiences.
Exactly. And while it can be a very challenging process, studies have shown that exposure therapy can be incredibly effective in reducing PTSD symptoms and improving quality of life.
I remember our source material also mentioned that medication can sometimes play a role in treating PTSD. Is that right?
Yeah, medication can be a helpful tool, but it's generally not the primary treatment for PTSD.
Okay.
It's often used to target specific symptoms like intrusive thoughts, nightmares, hyperarousal, or difficulty sleeping.
So it's more of a supplemental approach used in conjunction with therapy?
That's right. Antidepressants, for example, are sometimes prescribed for people with PTSD who are also struggling with depression or anxiety.
Okay.
And there are medications that can specifically target nightmares or help reduce hyperarousal.
It sounds like finding the right combination of treatments is key, and that probably varies from person to person.
Absolutely. It's a collaborative process between the individual, their therapist, and often a psychiatrist as well.
Right.
They work together to determine the best course of treatment based on the person's specific symptoms, needs, and preferences.
Now, I'm curious about something I read in our source material. It mentioned that in some cases, doctors might use high doses of certain medications, like benzodiazepines or antipsychotics,
Right.
to manage severe PTSD symptoms. Can you talk a little bit more about that?
Yeah, that's an important point to address. while those medications can be helpful in crisis situations, to help stabilize someone who's experiencing extreme distress or having thoughts of harming themselves,
Right.
they're not typically recommended as a long-term solution for PTSD.
So they're more like a short-term intervention to help someone get through a particularly difficult period.
Exactly. And there's growing concern that prolonged use of those types of medications, especially benzodiazepines,
Okay.
might actually hinder the recovery process in the long run.
Really? How so?
Well, for one thing, they can be habit forming.
Right.
But more importantly, they might interfere with the deeper emotional processing that's necessary for healing from trauma. They can numb those difficult emotions,
Right.
which might seem helpful in the short term, but ultimately prevents people from fully confronting and working through those experiences.
That's a really important point. So the goal is to find treatments that are both effective and sustainable,
Yes.
allowing people to truly move forward from trauma rather than just mask the symptoms.
Absolutely. And a crucial part of that is helping people reclaim that sense of control
Right.
that trauma often takes away.
You mentioned that concept earlier about restoring a sense of control. Can you elaborate on that a bit more?
Yeah, when people experience trauma, it often leaves them feeling powerless, like they have no control over their own lives or their reactions.
Right.
So part of the healing process involves empowering them to take back that control, to realize that they're not defined by their trauma and they have the strength to move forward.
So it's not just about managing symptoms, but about helping people reclaim their sense of agency and self-efficacy.
Exactly. And that's where therapy, especially trauma-informed therapy, can be so powerful.
Oh.
It equips people with coping skills, helps them reframe their narratives, and guides them towards reclaiming their lives.
This deep dive has been incredibly illuminating. We've covered so much ground, from the intricacies of the stress response to the complexities of PTSD and the profound ways in which trauma can impact us, both physically and emotionally.
It's a vast and complex topic.
It really is. And I think one of the most thought-provoking questions that our source material raised is this. If most PTSD symptoms are considered psychogenic, meaning they originate in the mind,
Right.
but trauma can also cause physical changes in the brain, does that blur the line between mind and body?
That's a fascinating question to ponder. It really challenges us to think about how interconnected our mental and physical experiences truly are, and it underscores the importance of addressing trauma on all levels: emotional, psychological, and even biological.
It's a reminder that we're not just minds or bodies, but these integrated beings, and healing from trauma often requires a holistic approach that recognizes all those dimensions.
I couldn't agree more. And for anyone listening who's interested in learning more about this fascinating world of psychology and mental health, I encourage you to seek out further information. There are so many resources available, from books and articles to podcasts and online courses, that can deepen your understanding of these complex issues.
And remember, knowledge is power. The more we learn about these topics, the better equipped we are to support ourselves, our loved ones, and our communities.
Well said. Thanks for joining us on this deep dive. Until next time, keep exploring, keep learning, and keep the conversation going.
And remember, fellow deep divers, never stop being curious about the world and the amazing minds that inhabit it.